Hey guys, so as promised, this week's video is going to be just a basic overview of diabetes, both type 1 diabetes, type 2 diabetes, and just some general information over like pre-diabetes and gestational diabetes. If you guys enjoy this video and want more, we can definitely dive into some other topics on this disease state. So you'll just have to drop a comment down below and let us know if you want to hear more about any of these topics we talk about today. So just a quick overview about diabetes. These statistics are coming straight from the CDC website. So according to the CDC, 37 million people in the US have diabetes and 96 million have pre-diabetes. Pre-diabetes is just kind of a precursor to diabetes, which means that if your blood sugar levels are left untreated, it could develop into a real diagnosis of actual diabetes. In Georgia, the Georgia Department of Public Health states that 1 in 10 Georgians have diabetes, and to give you a rough number, that's over 1 million Georgians, and thousands more have pre-diabetes. And lastly, diabetes is the 7th leading cause of death in both Georgia and the United States as well. So it's a pretty hot topic, especially here in the South. What is diabetes? So when we eat, our bodies break down food into glucose to use as energy. This glucose, aka sugar, has to be moved into our cells in order for them to work properly. And insulin is the hormone that is needed to move insulin into our body's cells. So when we get diabetes, this means that insulin is either not produced by the body or it's not used like it should be by our cells. So glucose, blood sugar, builds up in the bloodstream, leading to high blood sugar. In the long run, this can cause problems like heart disease, vision loss, and kidney disease. So let's go over the different types of diabetes. The first is called pre-diabetes, as mentioned earlier. It's a condition where your blood sugar normals are higher than they should be, but they're not high enough to be considered true diabetes. But again, this will increase your risk for heart disease and stroke. Type 1 diabetes is an autoimmune disease where your body doesn't produce insulin, and this accounts for 5 to 10% of diabetes cases. Type 1 is usually diagnosed in childhood, adolescence, or young adulthood, and the kicker is that individuals with type 1 diabetes must take insulin every single day. There is no cure right now that exists, and so that's why it is important to take your insulin like you should. Type 2 diabetes is a condition where the body is ineffective at producing insulin or using it, and this accounts for 90 to 95% of all diabetes cases. It is usually diagnosed in adulthood, but it is becoming more prevalent in children and teens. This kind of diabetes can be prevented with lifestyle modification. And the last kind is called gestational diabetes. This usually develops in pregnancy. It is tested for usually in the 2nd trimester of pregnancy, and it usually goes away after the baby is born. However, it can increase your risk for type 2 diabetes later in life. And it can also put your baby at risk for type 2 diabetes later in life. So what are the risk factors? For type 1, a family history and age, and also Caucasian descent. Type 2, a risk factor is pre-diabetes. Also, if you're overweight or greater than 45 years of age. Other type 2 risk factors include family history, sedentary lifestyle, different ethnicities also are at higher risk, including African Americans, Latino, American Indian, and Alaskan Natives. And another risk factor is fatty liver disease. Prediabetes has the same risk factors as type 2. And with gestational, some risk factors include history of gestational diabetes and a previous pregnancy. Also, if you have a baby greater than 9 pounds, if you're overweight, if you're over the age of 25, if you have a family history of type 2 diabetes, if you have PCOS, and also those ethnicities that we mentioned that were at risk for type 2 diabetes. So what are the symptoms? In general, you'll see possible urinary frequency, especially at nighttime, increased thirst or hunger, unintentional weight loss, blurred vision. You can have numbness and tingling to your hands and feet. You can have dry skin, fatigue, and you may also see delayed healing of wounds or sores. For type 1, you also may see some nausea and vomiting, abdominal pain, and symptoms occur quicker, or you may see them start earlier than you would type 2 diabetes. For type 2, the symptoms usually develop over several years and they start in adulthood. Although, like I did say earlier, we are seeing this happen more frequently in children and young adults. With gestational diabetes, you may not have any symptoms. The only sign that you may see is that test that I would mention about in the second trimester of pregnancy. That's usually when it is caught. So let's talk about type 1 a little more in depth. It takes a team to manage type 1 diabetes. You've got to work with your doctor, your pharmacist, possibly a dietitian, and other specialties to help maximize your health. So some type 1 diabetics may see a special endocrinologist to help manage their disease prognosis. But like I said, it takes a team of people to help keep those blood sugars within normal limits, and to specialize like your insulin dosages and your blood sugar checks, all that stuff. It takes a team. With type 1, you have to take your blood sugar every single day, and you have to take your insulin as prescribed so that you can keep your levels within normal limits. And when I mentioned that it's a team approach, your physician will customize your insulin dosages based on your blood sugar levels. Sometimes it's called a sliding scale. Also, sometimes they may just have a specific regimen for you, and that's going to be customized to your individual needs. Some tips for type 1 diabetics: we want you to stay active, eat a well-balanced diet, and control your blood pressure and your cholesterol. We also want you to see your doctor regularly and make sure that your insulin levels are always within normal limits, and that the regimen that they prescribe you is working for you. And you can also talk to your pharmacist if you have any questions about your specific insulin dosage. For type 1s, we want to be very cautious of two things: both hypoglycemia and diabetic ketoacidosis. Hypoglycemia is defined as a blood sugar of less than 70. So what are the signs and symptoms? You can have increased heart rate, shaking, sweating, dizziness, increased hunger, confusion, anxiety, irritability. If you have severe hypoglycemia, that means your blood sugar is less than 54. These symptoms often include weakness, difficulty walking or seeing, behavior changes, and even seizures. Severe hypoglycemia must be managed in a clinical setting. So what are some things that can cause hypoglycemia? Well, if you don't eat regular meals, or if you skip meals, if you consume alcohol without also eating food, or if you give yourself too much insulin, these things can quickly cause hypoglycemia. The biggest thing to take away from this is to regularly check your blood sugar and make sure you're giving yourself the correct amount of insulin, while also taking into account activity level or what the weather is like. If it's very hot or very cold outside, you need to properly manage what you're eating, and also check your blood sugar to make sure that you're not overdosing your insulin. So on the flip side, we have something called DKA, or diabetic ketoacidosis. This happens when you don't give yourself enough insulin to push the blood sugar into your cells, so blood sugar builds up. You have higher levels. Specifically, we want you to go to the doctor or the hospital if your blood sugar is over 300, because it must be managed in a clinical setting. What are the signs and symptoms? You have increased thirst and you're urinating more frequently. You also may have fruity breath, deep, fast breathing. You can have flushed skin, muscle aches, headache, fatigue. These are also symptoms of DKA. What are the most common causes? When you're sick, if you miss a dose of insulin, if your insulin pump, some people have insulin pumps, if the pump stops working or it's faulty, or if you take the wrong dose of insulin. So to prevent DKA, we want you to check your blood sugar regularly, keep your sugar within a target range, take your medication as prescribed, specifically your insulin, and if your insulin regimen needs to be adjusted, we want you to go see your physician. So regular doctor's visits. Type 2 diabetes. This happens, as mentioned earlier, when your cells don't respond normally to insulin, also known as insulin resistance. So your pancreas, which secretes insulin, tries to compensate by making more insulin. And eventually, your pancreas can't keep up, and so your blood sugar rises. This leads to heart disease, vision loss, and kidney disease. So the signs and symptoms will develop over several years, and they may not be noticeable for some time. Earlier, we mentioned the risk factors. You can back up the video again if you need a refresher on that. We manage type 2 diabetes by a healthy lifestyle, so healthy eating, stay active, get in regular exercise. We also want you to take your prescribed medication. So there are a few different types of medication that type 2 diabetics can take. Some of them are on injectable insulin. Some of them take oral medications like metformin. That's a very common one. And there's also other injectables that have come onto the market recently or within the last 5 to 10 years. So we keep harping on keeping your blood pressure and cholesterol at normal levels because, like we mentioned, out of control type 2 diabetes leads to heart disease, kidney disease, and so this is why we want you to keep your cholesterol and blood pressure in check. We also want you to check your blood sugar regularly, just like type 1s. Type 2 diabetics need to check your blood sugar every single day, and sometimes multiple times a day to make sure that you're keeping your sugar in normal range. And we want you to know what the signs and symptoms of high and low blood sugar are. Even for the type 1 diabetics, that same list of signs and symptoms of high and low can still apply to type 2. And if you're severely low or severely high, you need to go to the hospital. For children and teens, we want you to drink more water and decrease sugary drinks. So things like soda, fruit juice, energy drinks are a big one. We want you to watch those and increase your consumption of good old-fashioned water. We also want you to eat more fruits and vegetables and increase your physical activity. The important thing for kids is to make exercise fun. So let them be involved in rec sports, dance, go on family walks, or play games as a family outside. All these things make exercise fun and make kids want to be more active. So just a overview of the basics of diabetes. It's called Know Your ABCs for diabetes. A stands for A1C. This is a blood test that tests the average blood sugar of a 3-month course. So the average of your blood sugar over a 3-month period. Basically gives us a better idea of how well controlled your blood sugar is versus just a finger stick check at a random time of the day. So the goal for A1C is to stay below 7, but This is also a customizable number based on what your doctor recommends. So it's going to be, again, a team-based approach. See your physician and they will customize a level that they want you to maintain or achieve. B stands for blood pressure. We want you to maintain a blood pressure of 140/90 or less, depending on what your physician recommends. And C stands for cholesterol. We have a few different types of cholesterol. The first is LDL cholesterol. This is known as the bad cholesterol. This cholesterol tends to clog your arteries and blood vessels and increases your risk for a blood clot. HDL cholesterol is known as the good cholesterol. It helps remove the bad cholesterol from your blood vessels. And these numbers can vary based on what your doctor wants you to achieve. So we want you to, again, see your doctor for your customized plan of action. And then the last part of ABCs is the S, and that stands for smoking. Smoking tends to raise blood sugar, blood pressure, and cholesterol levels, which increases your risk for heart attack and stroke. So we encourage you to quit smoking or make a plan and go ahead and start working towards smoking cessation so that we can improve your health and extend your life. So this kind of wraps up just the basic overview of diabetes. And we did have one question on our Facebook page from Libby Johnson. She wanted to know, what are the worst fruits and vegetables for diabetics due to such high natural sugar? So first of all, this is a great question, and we get this question a lot because there are fruits that are very, very high in sugar. And so it seems kind of counterintuitive to say eat fruits and vegetables, yet they have high amounts of sugar. So let's kind of break it down a little bit. It's important to know that the sugar that is found in fruit is different than sugar found in things like baked goods, chocolate, soda. It's called fructose, and your body responds differently to fructose than it does to sucrose, which is the processed sugar. So because fructose is found in fruits, fruits are also high in fiber, and fiber in the body tends to slow digestion, so that slows the breakdown of that fruit into its sugars. So when you slow down the breakdown of sugar, it causes a slow rise of blood sugar compared to a spike in blood sugar that you would see with bread or a candy bar. So it's not going to spike your sugar as bad as it would if you were eating processed food. And studies have actually shown that the consumption of fruit, specifically whole fruits, can actually prevent diabetes, and it should be included in a diabetic diet. So we don't want to say don't eat certain fruits because they're high in sugar. We just want you to either eat it in moderation or pair it with high fiber, high protein snacks. So here's some examples. Apple and peanut butter and Greek yogurt, pair that together for like a fun dip. You can also combine strawberries with cottage cheese and nuts, and that's going to get you your high protein, high fat, and your strawberry, which is your fruit. And that all together is going to slow that breakdown of sugar and decrease the blood sugar spike that you would see when you eat something very, very high in sugar by itself. This same concept will apply to vegetables that have higher sugar contents. So a meal that you eat that has potatoes in it, combine potatoes with chicken and a green vegetable like broccoli, it's going to have high protein and high fiber along with that starchy potato, so you're not going to see that increased spike of blood sugar as you would if you were eating potatoes by themselves or with other high starchy foods. Another great example of a dinner or a lunch would be a taco bowl with corn, ground turkey or ground beef, some mixed greens, and include your other favorite toppings like bell peppers, onions, black beans. That combination of fiber, protein, and fat with that starchy corn or beans is gonna, again, lead to a less of a spike in blood sugar than it would if you were eating corn by itself. So we don't want you to avoid fruits and vegetables that are higher in sugar. We just want you to either eat them in moderation or pair them with a protein, fat, and fiber, okay? So yeah, that wraps up this video. I'm gonna link below in the description box where we got our resources from to make this video. The CDC is a great resource for diabetics, both type 1 and type 2. And yeah, so if you have any questions, you can always read more on those articles that I link below. And if you want to see more videos like this, comment down below, share this post, and let us know what you think. Thank you.